Did you know that nearly 1 in 3 adults worldwide have high blood pressure? Called the silent killer, high blood pressure or hypertension causes slow damage to your kidneys, to your eyes, to your heart, and can suddenly sneak up on you in the form of an acute stroke. But here's the good news. Controlling blood pressure does not always require numerous pills. By blending modern medicine with holistic practices, we can easily reduce the pill burden and keep blood pressure under control. Dr. Garg here, a board-certified nephrologist and an Ayurvedic health counselor. Stay with me as I share 5 powerful strategies to reduce blood pressure, including 2 pranayama and 2 yogasana techniques. Let us begin by understanding the high blood pressure treatments first. Modern medicines, they treat blood pressure mainly by 2 mechanisms. One is by dilating the tight and stiff blood vessels, and the second is by getting rid of the extra salt from the body. But this does not address the main cause of high blood pressure, which is the brain signaling and the stress-induced release of cortisol and adrenaline in our system. Ayurveda views hypertension as mainly a brain and autonomic nervous system problem, where body's adrenaline drive becomes overactive and the body's calming, relaxing, parasympathetic system becomes underactive. Pranayama and yoga, they very specifically target this brain and autonomic nervous system. So next we will look at therapies that work. Lifestyle modifications has been studied in many clinical trials, and simple measures have been found to be very effective in lowering your blood pressure to up to 10 points of mercury. The slide shown here is from my nephrology board review class, and you can see how simple lifestyle changes can improve your blood pressure. So let's look at our 5 easy hypertension tips next. Let us begin by understanding the high blood pressure treatments first. The first tip is the DASH diet. DASH diet is a short form for dietary approaches to stop hypertension. These are foods rich in potassium, calcium, and magnesium and have minimal sodium or preservative content. DASH diet is one of the most effective methods in any stage of hypertension, whether early or late. I have included a downloadable diet-friendly grocery list in the description links below. The second is regular physical activity. Movement is medicine. Our body loves movement and it releases these calming, relaxing hormones in response to exercise. Regular physical activity like brisk walking, swimming, or dancing can lower your blood pressure by up to 10 points of mercury. Aim for at least 30 minutes, 5 times a week. Even short bursts of movement like taking the stairs or just stretching during the work breaks can make a difference. Thirdly, now we come to the Ayurvedic remedies, and here are 2 Ayurvedic diet tips which have stood the test of time for treating high blood pressure. The first one is actually garlic, which is a natural vasodilator and has mild blood thinning effects which helps in improving the blood flow. You can try 1 clove daily, and it is better to take the natural garlic cloves than pills. The second is ashwagandha, which is a calming herb, and it's known to lower blood pressure. However, it is a medicine and it has interactions with other anti-diabetic or blood thinning pills. So do not take ashwagandha before consulting your physician. Next are the pranayama tips for hypertension. We come to 2 simple pranayama practices called Nadi shodhana or Brahmari. Both of these have been studied in clinical trials and they have been shown to reduce anxiety and hypertension. But before we come to that, there are some important prerequisites for pranayama that have to be followed for the pranayama to be effective. If you don't follow these prerequisites, then the pranayama practices will not be effective. Number 1, pranayama should always be done on empty or light stomach conditions. So it is most effective if done in the morning or in the evening on an empty stomach. You can also do this in your office just before your lunch. Second, Pranayama should always be done with spine erect, either sitting in cross-leg position or sitting on a chair with back straight and not resting. The spine should always be erect and should not be leaning on a backrest. Do pranayama in a quiet environment without distractions, so no pets or children climbing over you. If you have some sinus congestion or blocked nostrils, then you can do some brisk jogging on the same spot for 10-15 minutes. This will clear out the sinuses and now you can do your pranayama practices. Also, avoid doing pranayama if you're having an active fever, cold, or severe flu. The first one is Nadi shodhana or alternate nostril breathing, which helps in reducing blood pressure. It is a balancing technique that cleanses the subtle energy channels or nadis, and it helps in reducing anxiety. It slows the constant flow of thoughts, improves the quality of sleep, and reduces blood pressure naturally. A link to Nadi Shodhan demonstration is attached in the description below. Please refer to that link. Next is Brahmari Pranayama or the bee breath. It is a very simple pranayama that involves focused humming. So this has been proven to help sleep quality, mental clarity, and it has found to achieve significant reductions in both your systolic and diastolic blood pressure in some studies. A link to Brahmari Pranayama demonstration is also attached in the description below. A simple modification is just closing your ear cartilage with your index finger and humming the in exhalation. So you take a deep breath in, then close your ear cartilage and hum during exhalation. Remember the prerequisites. This has to be done on light stomach conditions, and your back or spine has to be up and erect. Last are two easy yoga asanas that help in reducing blood pressure. The first one is Vajrasana or the diamond pose. This is one of the easiest yoga poses and one of the few which can be done while eating and immediately after eating. This is how the Japanese sit when they are eating their meals. This posture has numerous physical and mental health benefits, which include improved digestion, improved leg strength, calmer mind, and lower blood pressure. See the link in the description for the demonstration. Remember that your big toes should be touching and your back should be straight during Vajrasana. You breathe deep and rhythmically in this asana, and you can begin with 3 or 5 minutes after your meals initially and then increase the duration to 10 minutes or more. Initially this will help improve digestion, but over a period of time this improves blood pressure. The second yoga asana is the Setu Bandhasana or the bridge pose. This back bend strengthens the spine, it opens the chest, it stimulates the carotid sinus which controls your parasympathetic nervous system. This should be done on light, empty stomach along with your other yoga asanas or your exercise regimen. A link again is attached in the description below. So this brings us to the end of today's video. With right diet, some exercise, some easy pranayama and 2 yoga asanas, you can control your blood pressure naturally. Don't forget to download the DASH-friendly grocery list and the links to the pranayama and the yoga asana practices. Please hit the like button, share this video with someone who needs this, and please subscribe for more integrative health tips. Until next time, take care and stay safe.